Wow. So before I introduce myself, everyone, I just wanted to react and say, stories like Dr. Pope really remind us that bias and discrimination, they're not abstract. They are like lived experiences by our colleagues and our neighbors. And just as health equity continues to be deprioritized, wanted to make sure that stories like this don't become more and more common, as we move forward. So just wanted to acknowledge that story by Dr. Pope. Now I just wanted to shift over and introduce myself. My name is Denise St. I am currently a project leader at the Boston Consulting Group based in Washington, D.C., where I help both public and private health organizations to develop research as well as enterprise strategy. My background is in public health. I am an infectious disease epidemiologist by training. I'm also a proud Californian, born and raised, proud woman of Caribbean heritage, child of immigrants, and someone who's personally and professionally invested in equity-driven practices in healthcare. We're having this conversation today because across the US, there's been growing uncertainty in the funding landscape for equity-driven research and health services. This year, that uncertainty has really hit a breaking point with drastic budget and staff cuts to the CDC and a funding freeze at the NIH that's disrupted research nationwide. But even beyond research, many nonprofits and community-based organizations, like we heard about in the prior discussion, that deliver care, those organizations are facing the same financial uncertainty, and we don't often get to hear about that in the news cycle. So with that context, I have with me a wonderful pair of panelists this afternoon, and we plan to unpack how these funding shifts affect both research and ultimately frontline care, and what it really takes to defend equity when it's under attack. So during this conversation, feel free to share your questions and comments. We'll have a Q&A at the end. And to get us started, I want to give our panelists a chance to share a little bit more about themselves. So let's start first with you, Dr. Elise, handing you the mic.
Good afternoon, everyone. I am Reverend Dr. Elise Saulsberry, Memphis born and raised, community pastor, advocate, author, and founder and CEO of Remnant Community Outreach. Remnant is a 501c3 grassroots nonprofit organization that works at the intersection of faith, mental and reproductive health, and human rights. We serve communities that often face the greatest stigma with the least access, creating spaces where healing, dignity, inclusivity, and justice can coexist. Our work isn't theoretical. So when we talk about holding the line, it's not theory, it's literally survival. In the Bible Belt, where policy, culture, and faith are deeply intertwined, advancing equity requires both courage and creativity while centering our voices as we show up for those who are most vulnerable and those most impacted. And I'm glad to be here.
Thank you for that, Dr. Elise. And now I want to just turn the mic over to Leah, our other panelist, and give her a chance to introduce herself.
Thank you. Thank you, Janelle and Ashley and the team at PF for inviting me. My name is Dr. Leah Lomotey-Nakon, and I serve as an assistant professor of bioethics at Baylor University in Waco, Texas. My work centers on the ethical dimensions of healthcare and how we design policies and practices that uphold the dignity for every patient and the people who care for them. Before joining Baylor, I spent nearly a decade partnering with health systems and funders to advance maternal and infant health, including initiatives with HCA Healthcare, the Prenatal to 3 Policy Impact Center, and Robert Wood Johnson's Health Policy Research Scholars. These experiences taught me that equity isn't just a principle, like Dr. Early said, it's a practice. So at Baylor, I'm continuing this mission through research and teaching that equips leaders to navigate complex ethical challenges while naming their own commitments and biases, while keeping justice at the forefront. I'm really honored to join this conversation because equity in healthcare is about compassion and care. And today I'm excited to talk about how systems can serve people and not the other way around.
Awesome. Thank you for that introduction. And so as I listened to the both of you share a little bit about yourself, what I noticed was that you're both working towards the same goal, but really coming at it from different vantage points or different settings. And so what I'd like to do now is, hear from the both of you. What are you seeing in your own work or in your own setting as these funding pressures take shape? And I want to actually start with you, Dr. Elise, and hear about what you're seeing in your community as in this current environment.
Sure. So in my own work through Remnant Community Outreach in Memphis and across the Bible Belt, I'm seeing funding pressure show up in deeply human impacting ways. It's not just about the smaller budgets, it's about the smaller margins for care, for connection, and for consistency. Funders are tightening priorities, shortening grant cycles, and shifting focus with each new administration. Before Roe was even overturned in 2022, we were already watching priorities shift away from community health, specifically in Tennessee with things, subjects, healthcare like HIV prevention, reproductive health, mental health, and maternal health care. When political winds change, many funders follow suit. So for small Black and Brown led organizations, grassroots led organizations such as Remnant, that means that we spend almost as much time, trying to survive the system as we do serving the people within it. We're constantly being asked to translate our lived experience and more urgency into fundable language. And that language takes a real toll on organizations such as Remnant. The harm shows up in practical ways: longer waiting lists for therapy, fewer transportation options. In a city such as Memphis, where public transit is already unreliable, and as many bus routes or many bus routes have been cut, the burnout among staff, doing 2 or 3 jobs, because when funding is offered to Black and Brown people of color-led organizations, it's rarely comparable to what larger national agencies or organizations receive. So even though we're the ones doing the work on the ground, we're doing the relational work, we're least funded. And the squeeze recently has impacted that work drastically. It looks like partnerships shrinking because those organizations have lost funding too, or had reduced funding also. And in Memphis, of all of that is compounded by local realities. So funding shifts also mean making hard decisions. We've had funders state that certain lawsuits or advocacy efforts that they may support, or those certain advocacy topics, aren't worth the hassle because Tennessee is a supermajority state, as if justice matters where it's convenient to pursue. And so these are moments where, as a founder, I've had to reach even into my own pockets to help people with gas or food, because it's difficult to look someone in the eye and say there's nothing that we can do because our funding has been squeezed or reduced. So again, the mental health crises didn't slow down because our budgets did or funding did, but our capacity to respond has been stretched beyond the limit, actually. And that's devastating when you're serving people already carrying the weight of trauma, poverty, and systemic neglect. I'll offer that what does give me hope is that we've been here before, maybe not to this extent, but we have been here before. And between organizations, creativity, and communal resilience, we've pressed through it. And so those are just a few ways that I've seen the funding squeeze, I'll call it, impact the work that we do here at Remnant.
No, I loved a lot of what you shared, and I really liked you talking about some of the specific things you've seen in your community. So I know you mentioned you're based out in Memphis and have worked throughout the Bible Belt, and some of those specific things, right, are the political dynamics. You mentioned access to transportation, people having to work multiple jobs. So I really appreciate you bringing that nuance to the conversation about what people in your community are very personally experiencing. Now I want to shift over to you, Leah, and hear from your perspective as well how you're seeing this, kind of how those cracks are showing up for you in your work in your community.
Absolutely. So I actually just moved to Waco, Texas about a year ago from Nashville, and we are literally the heart of Texas. That's what Waco is called. And I think what's been fascinating about being in a smaller community is the ability to be curious. So I have firsthand seen how these funding impacts are shifting because Waco is a small town, but it's bordered by rural communities. So thinking about the ways in which even Waco as a small town is serving as a hub even for these even smaller communities around it. And what have been seeing is how powerful it can be to be really clear and crisp about what you're focused on and standing on the business in ways that are authentic to reach across some of these seeming silos. So I was introducing myself in Waco just as at the height of the climax of the last election. And I grew up at the southern tip of Appalachia in South Carolina in the Piedmont. I grew up listening to Rush Limbaugh in the mornings, going to my great grandma's country church on Sundays, and spending my summers in West Africa. And I was like, if I can be this complex and hold this complexity within myself, how do I hold the complexity within the people that I'm meeting, not make the assumptions? And so I've been able to try to hold space as people wrestle with this new climate, trying to make some bridges that might not have been there otherwise. And then also thinking about like what are genuine moral disagreements, and then what are people like actually just speaking different language? Like if there's like a common moral thing that we can agree on and figure out what's actually different kind of languages around that, can we really get to a kind of commitment? So I've been seeing academic research as a tool for community change in this setting, thinking about the ways that I can serve, not just as somebody who's coming in to observe what's going on, but actually to be an agent of change, especially as things are changing so much and so quickly.
I love that. Thank you for that, Leah. And like I said, like it's what I love about hearing from the both of you is, like I said, you're both from the South, which is nice to hear. You have that shared experience, but just where you work today and the spaces that you're in, you're just tackling this from very different lens, and it's really nice to see just those different approaches as we kind of work together to kind of work in this current landscape. Um, so moving along, we've started this conversation talking about the upstream funding picture, and both of you spoke about your respective settings. But I would like to kind of push a little bit deeper in terms of how some of this is playing out in your community. And Dr. Elise, this one's coming to you. I wanted to ask, and you spoke earlier, like I mentioned, about some of those specifics of your community, but in which populations are there certain health conditions, or kind of are you seeing anywhere specific where the brunt of these cuts is really impacting folks? And then also, just as a tag along too, are there any ripple effects that surprised you or things you didn't expect to see as these changes rolled out?
Yeah, I can offer that I'm really not surprised of the changes that have rolled out. I think I'm surprised at the speed and the how many changes have happened simultaneously. So specifically in Memphis and in the Bible Belt where we work, when we talk about what's shaping the pressures which shape the environment, I would offer that it's really across the South, where I'm watching the impact of DEI laws being overturned, diversity programs being dismantled at universities. Right now, I'm in Atlanta, and just seeing the impact of DEI laws being overturned. Where there are, I'm sorry, and the diversity programs at universities, I am sitting where there are several HBCUs, is my point. But even there are a lot of shifts in nonprofits who depend on state contracts. And it's not just a culture war, it creates workforce crisis. So, over the past year, more than and I don't think we've even made a year that more than 300,000 Black women have lost jobs across the country. And so that doesn't just constitute people losing a paycheck. It impacts health coverage. It impacts all the things that Black women specifically face, LGBT communities. It impacts the access to health care for LGBT people of LGBT experience. And again, employment being impacted in Tennessee, where Cobra is simply not affordable. I don't know if anyone's seen what the Cobra prices look like when you're on the verge of your employment ending. it's almost impossible for many folks. And so again, we're seeing Black women, many of them who are caregivers, many of them who are, or us, who are heads of household, people having to choose between paying rent and staying insured. And that's happening again across the state, across the country at this point, but specifically for Tennessee, that has refused to expand Medicaid. So there are people that are falling straight through the cracks with no cushion underneath them. Again, the Affordable Care Act, the one policy that made healthcare accessible for so many, has been back on the chopping block. Every time it's threatened in Congress or in court, it sends a ripple of fear through our communities. And it's literally the difference between being able to get your meds or having to wait until an emergency. And by then, for many folks, it's too late. Seeing a lot of rural hospitals close, that is impacting all people, Black women, people of color, people in rural communities, physicians, providers, hospitals, their ability to serve and to really take the time to see the patients that they serve. And then there's, again, I think I mentioned earlier, the impact of Roe being overturned. In Tennessee, we're living in the midst of a, may as well say, total abortion ban. And so it's created an environment where doctors are afraid to act. They're afraid to serve the women and birthing people or those who choose not to birth, right? We heard, across the board, where there were doctors who were afraid to issue even something as simple to us as birth control pills because they weren't sure of their boundaries. And to put it frankly, some began to use their religious beliefs or preferences to determine the services that they're offered. So again, birthing people, LGBT folks, Black and brown bodies. And while all that's happening, the funding for basic infrastructure, again, things like transportation in a city like Memphis, people can't get to their appointments. People can't get the care that they need. Not to mention, we've had the National Guard deployed in the streets of Memphis under the banner of public safety. So it has led to mass arrests, overcrowded jails, fear in our communities. Folks are being detained in spaces that are already at capacity. Folks are, families are terrified, basically. They can't reach loved ones. They don't know where their people are. So funding has impacted all of these things, and it's not just, again, Black folks that are feeling the weight of the funding crunch. Again, our Latinx neighbors facing ICE raids and detainments. It's state-sanctioned kidnapping, basically, is what it is. I call it what it is. Families disappearing overnight, children left behind, parents unaware of where their children are. And so these are just a few of the communities that are being impacted by the shifts around funding or the funding crunch.
What I really like about some of your responses is that a lot of the things that you mentioned, I don't know that folks typically think about them in terms of health, but they are so critically related. You talking about people just losing their jobs, having insurance, being able to get to a medical appointment. These are things that people don't inherently think about when you talk about health funding, but they are so critical and they're so important. And so I'm glad that you brought some of these up in your answer and in terms of the specific communities and how they're being affected.
Thank you.
So thank you so much for that. And I want to continue the conversation, and I want to ask a question for you, and this is going to go towards you, Leah, to bring you in here. It's going to be a little bit of a pivot, but I want to ask you and move a little bit towards have you seen work? So in terms of, we want to talk about resilience here in terms of, a lot of these threats and the things that Dr. Elise has brought up that she has seen in her community. And I wanted to know from your experience, do you have any examples that you can share with us on ways that you have, held the line in this environment and things that you have seen work in this environment of funding pressure?
Absolutely. Thank you for that question. I am a bioethicist by trade, and so I am an eternal optimist about the power of our stories and about convening groups and working together. So I am currently working on reproductive health here and the connection between the church, and have been doing storytelling and oral history about how the church has been a role sometimes and a lot of times in supporting communities, and sometimes in being a barrier to people actually naming and getting care in the way that they need to. And so I have a grant that I was supposed to be these small intimate groups. And what I realized as I was rolling out this grant in this particular time is that people needed one another. They needed space and time to process what was happening, to literally let it sit in their bodies and be able to express what was going on. And so we turned what were supposed to be these little small focus groups into healing sessions. So we used art and art-based inquiry for people to literally tell the stories of what they're going through in this moment in time. And people are like, this doesn't feel like research. This feels like a community that we're building. And they asked me to come and do it with the youth. And what I've realized is that in this moment, being creative, imagining the future that you want to be living in, is actually some of the most powerful work that you can do. And giving space for people to live into that, to tell their stories of how they gotten over. So we had people in the session from their late 80s come, and we were making art, and they were like, my arthritis is not letting me do this, to the people who were just having their first children and sort of struggling what it meant to be postpartum. And just being in that space together, sharing a meal, being able to rest in each other's stories and be able to express that was part of the healing, was a respite from scrolling, for the young ones, scrolling Instagram and TikTok and feeling alone, or for the older ones being isolated in their homes. So part of the work is doing this mutual aid. And sometimes it looks financial, sometimes it looks like checking in on people. And sometimes for research, it means pivoting and saying, you know what, I had aims for this research, but that's not what the community needs right now. How can I shift and do my work in a different way that brings healing and holds the line in a different way, to say my line that I thought was interesting is not what is needed right now. So for me, it's really been searching inside, also asking my community partners, like, I'm new to this community. I know what works in the communities I've come from, but what will work here and now in this particular moment? So that's for me what holding the line has looked like, is actually being more flexible and responsive.
And can I ask you a quick follow-up on that, Leah, which is just as you've navigated this during the current time, have there been any specific just like sensitivities you've had to navigate, be that political, financial, community trust maybe has come up. You mentioned being new to this community. Just what have you had to navigate as you've tried to hold the line in your community?
For sure. What is really funny is that when you say I do reproductive justice, depending on someone's makeup, they might have a whole story that they may not tell you, may not say what they are thinking about what you're saying that you're doing. But for me, the sensitivity is meaning that when I say my words, I'm having to be more conscious of what it means to someone else and what triggers they're coming up with. They're like, I can't work with you. Some people saying, I don't do reproductive justice, or I can't say that in my grant, or I don't want to show up to your meeting in case somebody's and I'm saying like, no. This is what we're doing. We are talking about health. We are talking about what it means to be anything from just at the beginning of a reproductive cycle to menopause. And so I say that the fear is living in people's bodies, and realizing that what I could say comfortably of even months ago, right now brings up fear and trepidation. Even the way that I write grants, people are flagging things that like that don't even show up on the like bad list. They're not necessarily words that, but people are so afraid and so sensitive to what might be called out, versus saying, here's the work that I'm doing, here's the goals, here's the world that I envision, and instead sort of like operating in that fear. So for me, it's meant actually asking that double click and being curious and saying, what do you think that I'm saying? Or really doing that extra work to not say that I think it's a no, it's a okay, so give me a minute. Let's circle through this a little bit. So for me, it's been realizing that people have all these schemas that they've built up either from a long time ago or from these last few months, and saying, can I push that a little bit? What's really going on here? What's really the fear? Or is it, and that's why I go back to what I said at the beginning, is it a genuine concern or is it a fear of the boogeyman, I guess, so to speak? Yeah.
Right. Thank you for elaborating on that. And now I'm going to go to you, Dr. Elise, and ask you the same question. And you talked a lot about, things that you've seen in your community that have been, really challenging to hear about. And I wanted to ask you, do you have examples of resilience and things that you have found work in this current climate?
For sure. I will offer that working directly face to face with community is our work. And so asking community what the need is, and being in a position to flex, again, as was stated, from what our goals might be to what community says. And so one of the ways that we have shown up is to show up for example, I had a young man, a man of trans experience, who could not get his driver's license changed. And so normally it looks like handing that work to a LGBT organization, but instead we showed up with him at the county office and we spent all day there assisting him until they changed his name on his driver license. And it was literally the day before Tennessee banned people from having the ability to change their gender on their driver's license. And so that's one of the ways through our programs, Engage, we work directly as a pastor working with other pastors and churches to provide meals, right? With SNAP being, there are thousands of people at this point, even across Tennessee, even in Memphis, that have not received their benefits. It looks like partnering with other churches and organizations to serve those folks. And I've seen community come together in a way that we're always resilient, right? Because we've been here before, but it's a different level of coming together with the SNAP benefits. Because considering Maslow's hierarchy of needs, we can't get to healthcare unless we ensure folks are fed, right? So the first thing that are on people's minds right now is the ability to eat so that they can survive and at some point obtain the healthcare that they need. So that's another way that Remnant is showing up. We have Faith Unfiltered online conversations where we have bold conversations regarding LGBT rights, abortion. We have these conversations with faith leaders, with activists, with people who have had and have had lived experience, right? And so we have them in a matter-of-factly way, and it's our way of pushing back against the administration who has said no to who people are and have attempted to force us to invisibilize ourselves. And so that's a way that we are adamant about showing up. As a founder, I think I mentioned earlier, with there being a funding crunch, being able to offer the services that I'm able to offer people, even sometimes if it has had to come out of pocket. So that's a way that we've shown up. It hadn't always been the wisest thing to do, right? But that's the way that we show up. And so we're accustomed, because we've been here before, like I said, maybe not this drastic, but we're accustomed to showing up and filling in the gaps. I think COVID was a precursor to what we're dealing with now. So the ways in which we flexed our work, what we couldn't do in person, we did virtually. We do that now, again, with Faith Unfiltered, with organizing clergy in person and virtually, to show up to educate clergy on policy and how to deal with policy as a person of faith in the midst of Christian nationalists attempting to control what everyone's lived experience look like. So educating clergy who are in rural areas on policy, educating them on how to show up for people, even though they may hold a certain belief, helping them to understand that human rights looks like everyone getting to express who they are while not, I'll say, offending or superseding another's or superimposing, I'll use, on another's rights or beliefs, but having mutual agreement and basically operating out of the age-old thing called love. That's how we show up at Remnant, showing love to all people. Education, again, policy education, service in whatever it looks like where we're humanly possible. It looks like in our mental health advocacy work, showing up at mental health facilities that are taking people in. They're doing the intake great, but they're getting people in, and people are having bad experiences because a lot of these facilities, just like jails, I'll liken them to, are overcrowded, right? So, and people aren't getting the help that they need while these facilities and institutions are being paid and saying that they're serving them in the way that they're showing up. So those are just a few ways that we've shown up to help people in the midst of all that's happening at Remnant.
I love that. And I wanted to continue this conversation, like continuing to talk about solutions and being innovative in this particular moment. And I'm going to turn it back to you, Leah. I don't know if you mentioned it, but I know that you also have a bit of like advisory experience and have spent time working with funders. And I'm curious if from that experience, if you have seen anything in terms of funders actually taking the time to be creative now and saying, how can we, show up to the moment, and how can we, be that person that helps an organization like, Dr. Elise's and show up in the way that, we see community organizations and nonprofits stepping up. So just wanted you to, if possible, speak to from put that advisory hat on and speak to anything that you've seen.
For sure. Like Dr. Elise said, the need is just outpacing the resources, and community, philanthropic, and faith-based organization, they're critical, but they were never meant to be a replacement for social services. So that's part of the mismatch, is that what funders and program teams are trying to do is match the pace, but they, even with their power to do good, they still have to work within their own constraints. And of course, with the funding not being limited, they're trying to figure out how to be strategic with investments, how to get money out the door in ways that are equitable and trust-based. But then at a certain point, then they can't necessarily overspend certain requirements. So I've seen some really thoughtful program teams that are trying to figure out, how do we maximize our disbursement? How do we give more funds? Then there's all these kinds of, which are way in the weeds, but issues they can't give a certain amount to organizations without doing tipping. So there's all these sorts of constraints that have nothing to do with the funders, that when we're trying to immediately respond to need, they have to still be thoughtful. But what I love is that increasingly folks who are on the program teams are coming from community. And I think that's been the most powerful thing to see, is that these are not people who are just sort of like living in their bubbles of philanthropy. They have either led organizations like Dr. Elise, or they've come from the communities that they're now providing grants to, and are able to really be thoughtful about how they do the grant making. I think that is also important, is being able to be responsive. The same with that, as an academic, I can say, hey, what I'm doing is not working. I think increasingly funders and their teams, their executive teams, are like, how do we do this more creatively? How do we build trust in ways that somebody who's working in community can say, hey, thank you for the funding. We need this right now. And I think that that's what I see is so beautiful about the future of funding, and some of the leaders in that space who are saying, we've got to do this differently. We can't necessarily change how much funds are available, but how do we prioritize and incentivize other ways of doing the work? And so I've been really enthused that people are actually trying to figure out, like, how do we get more money out the door faster and more responsive? But then you go back to what Dr. Elise said, and it's like, it's just never meant to you can't replace SNAP or Medicaid. You just cannot do that with a funder, a place-based funder, or whether they're a national funder. They just can't do it. And so it's almost like this cruel sort of loop where there's just, everyone is sort of like, there's not enough to go around. And so that panic of like, what can we do, feels like the point sometimes. But they're not. And I think one of the things that I find beautiful is that there was a moment of like panic where it's like everyone's going to be coming after. And I feel like there's like, people are sort of not freezing anymore and saying, okay, I may not have the perfect solution, but don't let let the perfect be the enemy of the good is that statement of saying, how do I just do and rapidly innovate and say, okay, that one didn't work, but let's try this other one, and being a little bit willing to fail. Like I didn't get it exactly right, but I'm gonna get the money out the door and try again the next time. So I think that that willingness to try and be in community is what I'm seeing and being and a little hopeful for.
Awesome. Thank you, Leah. We're coming up on time, but I want to make sure we get a chance to, incorporate some of the questions that were asked by the audience. So here's one, and I actually do think I think Dr. Elise might be a good person to tackle this one. But a question was asked about how we can work respectfully with communities that view disease as a sin and individuals living with disease that are fearful of letting anyone know that they are suffering and are in pain. So wanted to, and Leah, don't feel like you cannot also answer, but I did want to put that question out there and give you all a chance to respond.
I'll offer that. I think there are communities that we just won't be able to reach. That's our reality, right? Because it is difficult to separate people from in their indoctrination when they're not willing to sit and have a conversation. So, in my opinion, I think the first thing to do is see if that person or a group of people are willing to come together to have the conversation first, right? That's how you know if there's any chance for partnership or conversation. And if they are, I think now a lot of people are willing to, at minimum, listen, whether they agree or disagree, but coming together, as the Bible calls it, to reason together, right? Putting the most important and most impacted and vulnerable communities at the center of the conversation. For example, again, as a pastor, let me be clear, a lesbian pastor, I have to walk into rooms with men who don't believe women can pastor. But when I show up, if they're willing to have whatever the subject or topic of that conversation is, then we have the conversation. Sometimes we're willing to walk away and disagree respectfully. And sometimes there's a response, even if it's just from one person in a room that says, I'll think about that more. I'll think about that a little bit more, or I'll revisit the scripture. And a lot of times when I go into these conversations, part of our work at Remnant, a lot of our work at Remnant is pulling biblical texts to literally show the person or people that we're training. The cultural humility trainings is another way that we do our work at Remnant. So literally showing the folks that we're having these conversations with scripture that is in context where it's irrefutable. Now, I will offer that I've done that with Tennessee senator whose name I won't call, but it was about abortion. And when I led him to Numbers 11, where it talks about abortion or God-given permission for abortion, even the potion for abortion, I asked the senator, I said, have you read this text and what do you think about it? He had never read the text, didn't know it existed. So one of the things I'll say for strategy is to go into the spaces and have that study so that you can have those conversations. I'll offer for him, he shut the Bible and he had a meeting. That was the response that I got. But it's not always the response that I get. And it's the spirit in which I approach or we approach as educators and activists and professionals. How we approach people sometimes determines their response. So I'll offer those things: education, 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 and training is how that can be done. And also when it's not something that an organization or even a pastor or healthcare professional, if it's not something that that individual is trained in or versed in, it is absolutely okay to partner with other organizations or clergy who specialize in those trainings and conversations. So I'll stop there.
Thank you for that, Dr. Elise. And just, being mindful on time, we're going to wrap up this discussion. I want to thank you both for, coming into this space and bringing the two perspectives that you have, your work on the ground, your expertise to this discussion. What we've heard, right, is that defending equity at this time, it takes adaptability, right? It takes having to be creative and sometimes putting in your own funds, right? It involves really knowing your community and adapting to what they need in the moment. And also, just like I said, it sounds like it just requires a bit of just like faith and hope as well, just to keep that worth going. So just as we close, I really hope that these lessons help all of us to keep equity at the center of innovation and the work that we're all doing going forward.